office, what, about a month ago?
Mm-hmm.
And I said,
Oh my God, you're a dentist?
yeah.
I'm scared to be in here.
I said, would you be interested in coming to talk to my support group? And lo and behold, he said, oh yeah, I do presentations all the time. I went, come on. So, y'all, I would like to introduce you to Dr. Kacos.
Good to meet you.
This is his lovely wife back there operating the camera.
Yeah.
So, we'll go ahead.
Yeah. So if y'all don't mind, I'm going to record the presentation today. I'm going to put it on my website because I think there's going to be a lot of valuable information for other people. And you know, people are Googling this kind of stuff all the time, and it shows up across the world. So I'm going to try to help as many people from right here in Shreveport as I can, okay? Miss Miller, if you'd have told me there was lunch, I probably would have volunteered a month ago. So you should throw that into the next time you're trying to find somebody.
I will.
Yeah.
I will.
Like Miss Miller said, my name is Ben Kacos. I'm a dentist here in Shreveport. I went to the Medical College of Georgia. I'm a member of the Academy of General Dentistry, and I'm actually accredited to provide education to other dentists through the Academy of General Dentistry. I'm going to be the president of the Northwest Louisiana Dental Association starting in December.
Wow.
Yep, and I'm a coach for the Dental Success Institute. Also a member here of the Academy of Cosmetic Dentistry and the Academy of General Dentistry.
What are you doing in your spare time?
Yeah. This is what I do in my spare time. This is, I've got a 3-year-old son named Wilds, my wife Marion that's here in the back, and a 1-year-old daughter named Elizabeth.
Oh.
And we just had our pictures taken in the cotton field. Marion's family's been farming cotton there for 100 years now.
Wow.
Just down Uri Drive.
Oh, wow.
Yep.
Oh, is that the one that's in the middle of town?
No, it's past the relay station. I don't know if you know where that is. But
It was just so strange when I moved here because you'd have businesses and everything. All of a sudden you had all these cotton fields.
Yeah.
on your region.
yeah. Today we're going to talk about oral health and cardiovascular health, and the missing link, because they really are linked and most people don't know that. If y'all have any questions at any time, feel free to ask. You can try your best to stump me. You probably will. And I'm going to just insert some quick facts throughout the presentation. So first of all, let's talk about cardiovascular disease. 2 million Americans suffer from a heart attack or a stroke every year. So it's a pretty big problem here in our country. Of those 2 million suffers, 800,000 of them die every single year. And cardiovascular disease is the #1 cause of death in the USA. Now, when we talk about women instead of the general population, just women, some facts there. The top 3 causes of death for women is cardiovascular disease, then cancer, and then respiratory disorders. So cardiovascular disease, heart attacks, and strokes is really a major problem for women. In fact, heart disease kills 10 times more women than breast cancer does. And it's Breast Cancer Awareness Month right now. About 66% or 2/3 of all strokes that women suffer from are fatal. So you survivors are only the 1/3 of the lucky group. Okay, the other 2/3 didn't make it to the meeting. And I'd just like I thought it was interesting that even though cardiovascular disease is the #1 killer of women in America, how come we don't have a cardiovascular disease month with ribbons all over the place and walks for this kind of stuff to further research like we do for breast cancer? I know breast cancer is a huge problem and it needs attention too. It certainly does. But what I've come to the conclusion of in my own mind is that the difference is cardiovascular disease is preventable. And breast cancer isn't preventable. And there isn't a cure for breast cancer. So I think that's why cardiovascular disease is fallen by the wayside, so to speak, and gets less attention, because there is things that people can do to help prevent it. So I don't know how much y'all know about cardiovascular disease. So let's just start with what it is. We have all these blood vessels throughout our body. They go from the tips of our toes to the tops of our head, right? And they can fill up with cholesterol, and the cholesterol can cause a blockage. Okay? Any blockage in our vessels is cardiovascular disease. Okay? There's two other ways that you can suffer from a cardiovascular event, and that is from a blood clot or from part of one of these clots of cholesterol breaking off. It's not necessarily that it's 100% clogged, because you've heard your doctors talk about how clogged an artery or a vein is, right? 50%, 70%, and this one's all the way closed. It doesn't have to be all the way closed. Part of that blockage can come free, like a log in a river coming free and going downstream and getting caught further downstream. Does that make sense? So there's two types of cardiovascular events. You have a stroke and you have a heart attack. Now they're basically the same thing, they just occur in different parts of the body. All right? A stroke occurs in our brain. We have tons of vessels in our brain that supply the most important organ in our body, right? And if one of those vessels gets blocked by cholesterol or by a blood clot, that creates a stroke. Now there's a third way that you can have a stroke. That's if one of these blood vessels ruptures or breaks open like a water balloon. Okay? The other type of cardiovascular event is a heart attack. Now our heart attack is a big muscle, and our heart is a big muscle, and that's what's pumping blood through our body. Everybody knows that, right? But our heart needs blood too. And so there's vessels that support our heart muscle that's always working. It never gets a break. And if one of those vessels inside our heart gets clogged by a blood clot or cholesterol, that's what a heart attack is. So what causes the blockage? I touched on this a little bit earlier, but blockages are caused by three things, whether it's in the brain or in the heart. Okay? We have something inside our vessels called plaque. Okay? Plaque is created by cholesterol that builds up inside of our veins and our arteries. Just like stuff that builds up inside your drains. You can pour Drano down your sink. You can't pour Drano down your throat. So the stuff inside our body continues to build up and build up and build up. Okay? So as these vessels close, there's less and less blood going through them. Does everybody follow that? Now if you get your blood pressure up, okay, or if you are experiencing a lot of inflammation, part of that blockage can break off and go free like that log going down river. When it gets to a smaller place in the road, like you go from 4 lanes of traffic down to 2, it creates a traffic jam, right? The same thing will happen in your vessels. When that part of that plaque breaks off and it goes down the highway, when it comes down to 2 lanes, it's going to create a problem. Okay? Now, ruptures inside our vessels, where our vessels break or burst like a water balloon, those are due to two main causes. That's high blood pressure, which our doctors are always checking on for us, right? And inflammation. Okay? So chronic inflammation is the #1 cause of cardiovascular disease. I don't feel like that's talked about enough. We hear a lot about vessels clogging and closing up and how closed a vessel is, 70%, 90%, but we don't really hear about inflammation that often. So I'm going to make it a point to talk more about inflammation to y'all today. Inflammation is actually the biggest player in destabilizing plaques. Okay, so these parts that break off that we'll talk about, that's typically due to inflammation. It's caused due to inflammation, and also the blood clots in our vessels. That's caused by inflammation as well. So when we're talking about how clogged a vessel is, and lots of doctors like to touch on this one is really, really blocked and this one's more open, so we need to concentrate on the more blocked artery. Now you've probably had this conversation with your doctor. What's interesting is that what's a better predictor of rupture or cardiovascular event is not the size of the blockage. It's how much inflammation you have in those vessels. So what that means is a vessel that's less blocked, okay, let's say you have one that's 75% blocked and one that's 25% blocked. Old school logic would tell us that 75% blockage is more dangerous. But new school research is telling us that's not the case. It depends on how much inflammation you have in those vessels. So actually, the 25% clogged vessel could be much more dangerous if it's experiencing more inflammation. Okay? So why do we only check for large blockages? It's a lot easier to figure that out. And our healthcare system has kind of failed us with insurance coming into play, and the doctors are starting to do more blanket care instead of individualized care. That's an easier test for these doctors to run, and they're under a lot of pressure from their hospitals and the big groups and the insurance companies to treat everybody the same and see as many people as they can, right? These are good doctors. They want to do the best thing, but sometimes they're not always given the tools that they need due to these constraints. So, inflammation and atherosclerosis. Do y'all know what atherosclerosis is? Anybody familiar with that term? Yeah. So it's a fancy term for the hardening of these vessels in the blockages that I've been talking about. Okay? So they work hand in hand, the inflammation and the blockage. It's a two-way street. Let me explain to you how it works. We eat and we ingest cholesterol. Everybody eats it all day long. You can't avoid it. And there's good cholesterol and bad cholesterol, right? HDLs and the LDLs. The LDLs are the bad cholesterol. So as these LDLs are going through our vasculature, our veins and our vessels, it's floating freely until it encounters a place of inflammation. Okay? When it encounters that place of inflammation, that vessel wall is sticky when it's inflamed, and that LDL cholesterol sticks onto it. Okay? And it starts to build up there little by little, just like the drains in our house clogging up little by little. The interesting thing is, the more of that cholesterol that accumulates, the more inflammation there is. That makes it stickier. So do y'all see what's happening here? The inflammation started it. The cholesterol starts to stick. The more cholesterol that gets stuck, the more inflamed the vessel gets. So then it's just a downward spiral. Y'all follow this? So it works hand in hand. Now, believe it or not, this atherosclerosis, this cloggage inside the canal there, inside the vessel, is not on the inside of the vessel where the blood's squirting by. It's actually underneath a very, very, very thin layer. Okay? So there's a very thin layer that's 1 cell thick in between the blood going by out here and the rest of the vessel wall. Okay? So it's underneath the first layer of the hose. And as that first layer of that hose gets more and more inflamed, it's only 1 cell thick, right? It can cause a rupture of that one little layer. Now, you've cut yourself before, right? You know how that blood clot forms to stop the bleeding? We have these parts in our blood, these particles in our blood, and it's all like you take a piece of Velcro, and you take that Velcro apart, one piece by one piece and one piece, and you set them down over here, okay? And you got a hose, and you just start sending one piece of that Velcro down the hose, one at a time. And it comes to that cut in the hose, and it's sticky inflammation. So that first piece of the Velcro sticks, and then the next piece sticks, and the next piece sticks, and the next piece sticks. That's what stops us from bleeding when we cut ourselves. Okay? That's also what repairs our vessel wall when that first layer breaks, that rupture. That Velcro, that blood clot starts to patch that hole in that cell wall. Okay? And that's how we end up with something called a thrombus. A thrombus is a blood clot that's stuck in our blood vessel. It's doing its job. It's clogging the hole where the bleeding is occurring, right? And it's safe there. It's just like the clot, the scab on your finger when you cut your finger in the kitchen. That's a thrombus. Now, if that thrombus comes loose, that Band-Aid inside one of your veins comes loose and goes downstream, it's now known as an embolism. Embolisms are dangerous. Okay? Embolisms are what cause strokes when they reach the brain. Okay? So, I've talked to you over and over about inflammation. I'm going to start to talk to you about where inflammation comes from. 75% of Americans, that's 75 million Americans, suffer from gum disease. Gum disease increases the chance of a cardiovascular event by at least 2 times. Some researchers say 3 times. Okay? Little quick fact that I'm going to throw in here. humans have 60,000 miles of blood vessels inside of us. If you took all our veins and arteries and capillaries and you stretched them out, they'd go around the world twice. And that's where we have this opportunity for inflammation throughout the 60,000 mile network, okay? Hey, come on in.
Hey. How are you?
We got a present here. Grab some notes and a pen in case you want to jot things down.
You have one of these. Sit over there. Would you?
I got that one. I remember that. One of the key things I remember.
So there's 2 million cardiovascular events a year, okay? 800,000 of that number are strokes, okay? This was very, very interesting to me when I was doing my research. 25% of these strokes, or 200,000 strokes a year, are not the first stroke that person's ever had, okay? So once you have a stroke or a heart attack, you're much more likely to have one down the road. Now with heart attacks is 33% of heart attacks are second or third or fourth heart attacks in that patient. All right, so you can see that once you've had one of these things, you're much more prone to experience another one. So it's very important to try to change your lifestyle. I would classify that as a stroke. Now, the nomenclature of exactly how your physician delineates the difference between a stroke and a traumatic brain injury, that's outside my realm of expertise. But it does create an injury to the brain. So it's the same, it may not be the same exact cause, but it's going to create the same effect, that loss of blood flow in the brain. Yes, ma'am. All right, so let's talk about some of the risk factors for cardiovascular disease. Diabetes, genetics, plaque in our vessel walls, smoking, high blood pressure, and poor oral health. Did you know that diabetes quadruples your risk of a cardiovascular disease, cardiovascular event? That's due to the inflammation that diabetes causes. Okay? So what is diabetes? Are you all familiar with what diabetes is? Okay, so we have insulin in our blood, in our bodies, and two types of hormones, insulin and glucagon, and they regulate our blood sugar. Okay? There's two types of diabetes. You got type 1, those are folks that are born without insulin. Okay? And type 2, those are folks that have created so much insulin over the course of their lives that the receptors that listen to that insulin don't listen anymore. It's like you've had the music turned up in your house for so loud for so long that you go deaf. That make sense? Same exact thing. These receptors have been submitted to so much insulin over the course of years that the receptors just start ignoring it. Don't listen to it. Okay? So how do we test for diabetes? This is pretty interesting to me also because I find that oftentimes the wrong tests are being done. What's recommended to the most accurate test for diabetes now is called a 2-hour oral glucose tolerance test. Okay? That's in your notes. It's called an OGTT. And the way that works is you quit eating, you fast for 8 hours. And then you go into your doctor's office and he's going to test your blood after you hadn't had anything to eat or drink for 8 hours, and he's going to see where your blood sugar level is. Then he's going to give you a sugary drink. You drink that sugary drink, and then they start testing your blood every 30, 45 minutes, 60 minutes, and see what happens to that level of sugar inside your blood. Okay? This is the best way to catch diabetes before it's diabetes. This is the best test to run to catch a pre-diabetic state. We obviously would like to treat it before it turns into full-blown diabetes, right?
What were those initials?
OGTT. It's going to show up here in a slide or two.
Is that reversible?
You can change. Yeah, you can change, make lifestyle changes to stop the progression into full-blown diabetes. And this is really important to y'all because you remember a few slides back I showed you that diabetes increases your risk of a cardiovascular event by 4 times. So if you can fix that before you get there or better regulate it, you're going to be a lot healthier. Okay? So what we're learning through science and modern research is that our bodies are really connected to our mouth. More and more and more we're realizing this. Okay? The mouth bone's connected to the body bone. Okay? And what we've learned is that diabetes and oral health are connected, hand in hand. I'll touch on that more in a little bit. So, some of the other older ways that people have been tested for cardiovascular risk factors, one of the most famous tests was called the Framingham Risk Score. And what they did is they looked at your age, your gender, your cholesterol level, your blood pressure, and whether or not you were a smoker. Okay? Now, it didn't account for some really, really important things. It didn't account for your weight. Okay? It didn't account for your family history of cardiovascular disease. And it didn't account for whether or not you're a diabetic or a pre-diabetic. Something that I think is a much better predictor of cardiovascular disease is called the Bale-Dineen method. This was created by Dr. Bale and his assistant, who is a nurse. And let me tell you about Bale and Dineen. This is a book called the Beat the Heart Attack Gene. I read this book, and it was very, very informative for me, and I got each and every one of y'all this book. They wrote this book. Okay? I'm going to read to you who Bale and Dineen are. Bradley F. Bale is a physician, and Amy Dineen are co-founders of the Bale-Dineen method, which they teach to healthcare providers in their American Academy of Family Medicine accredited program. They co-founded the Heart Attack and Stroke Prevention Center in Spokane, Washington. Amy Dineen is the medical director at Texas Tech Health Science School of Nursing and the past chair of the Pacific Northwest Preventative Cardiovascular Nurses Association. Dr. Bale serves as the medical director of the Heart Health Program at Grace Clinic in Lubbock, Texas, and has a private practice in Nashville, Tennessee. So you can tell from their credentials, these are two really, really smart cookies here. And they've put together a battery of tests that is much more informative and can really help you so much more than this old school Framingham risk score that doesn't fill in all the blanks. Okay? There's a lot of information about this Bale-Dineen in the book I'm going to send you home with today. So, quick fact, more than half of the American population has at least one risk factor for cardiovascular disease. So, we've talked about inflammation. Where does inflammation come from? Periodontal disease, that's a fancy word for gum disease, okay, is the most common form of chronic inflammation in the world, okay? 75% of Americans have some form of periodontal disease. Half of the population under 30, half of young people have gum disease. 70% of people over 65 have gum disease, okay? And we're going to talk more and more about gum disease or periodontal disease. So, what is it? What happens is we have plaque in our mouths, okay? Now, the plaque in our mouths is different from the plaque that I talked about in your blood vessels. The plaque in our mouths is made only of bacteria. There's no cholesterol, okay? But we have about 600 different types of bacteria in our mouths. And bacteria grows. You think you've heard reproduce like rabbits? Rabbits got nothing on bacteria. Bacteria is reproducing around the clock non-stop, okay? And as this bacteria grows and grows and grows, it forms plaque. Now, plaque is what we brush off our teeth when we brush and we floss, okay? But if that plaque gets missed, if any of that gets left behind, it gets hard like an eggshell, okay? And now you've got a hard splinter that's made up of nothing but bacteria, okay? And so I want you to imagine if you have a splinter in your finger. You know what your finger looks like when that splinter gets in there? It gets red and swollen and is angry. That's a piece of wood. Imagine if that splinter was just made up of dirty germs. Okay? That's what's in our gums. And so what happens is our body sends our immune system. It knows that something's wrong, and our immune system comes along and it starts to fight these bad germs in our mouth. It creates a cascade event. So the immune system comes and it says, hey, we got invaders, this is bad, everybody help. You know, bigger the fire, the more fire trucks we need. So they start to call more and more fire trucks to come and put out this fire. Okay? That's what a cascade event is. All right? So it creates this cascade event. These germs in our mouth create this cascade event. And you get all these soldiers coming to fight to kill the germs. And the soldiers, they bring bombs and missiles and guns, and they start killing the germs with these chemicals that our body makes, all right? And these chemicals are made to kill germs. They're very, very strong. And what they do is they actually kill everything that's around them, all right? So this is inflammation. This is what's happening in your body when you get a splinter or an infection. This is an infection in your gums, okay? And when they're throwing these bombs, killing these germs, it kills everything around it, okay? So it starts to kill your gums and your bones, okay? So I told you we have 600 species of bacteria in our mouths. And here is an example of this brown stuff. This is our tooth. Obviously, this is a happy tooth with happy gums. Here's the plaque that starts to build up that maybe you missed it, you didn't floss real well, or you didn't get that part of your tooth real well. And this plaque starts to build up. Then the first two soldiers show up and they start fighting those germs, okay? And our gums start to experience this inflammation. And you see how the gums start to peel away from the tooth here? They're not tight against the tooth like they used to be there. All right? Well, those two soldiers start to call their buddies. All right? And the more soldiers we get trying to fight this plaque, the more inflammation that our gums experience. Okay? And the more inflammation that's there, the more the gums peel back off the tooth. Have you heard that saying, long in the tooth? Because older people, their teeth look longer. That's because their gums have peeled back. Their teeth haven't grown. Their gums have gone away. So you can see more of the tooth. All right? So when the gums peel away, the bone goes away underneath the gums. And what we say is the tissue is the issue, but the bone sets the tone. That's what the dentist says. All right? So as the tissue goes away, then the bone goes away. All right? This all starts, the first step of this is called gingivitis. And I bet you every single one of y'all has gingivitis. All right? When they talk about half the population under 30 has gum disease, that's probably just gingivitis. That's the very first step. And you can see that this person has red swollen gums here. That's gingivitis. If you brush your teeth or you floss and it bleeds, you at least have gingivitis, maybe something worse, okay? But you know if it's bleeding, you at least have gingivitis. So, as those gums start to peel back like we talked about, the tissue is the issue, but the bone sets the tone. Remember me saying that? Here's an x-ray of some teeth. And what I want to show you, here's the tooth. This is the part that we see in our mouth. And here's the roots of the teeth. Now the roots of the teeth are in bone, just like your mailbox is in dirt. Okay? The bone around these roots is like the dirt around your mailbox. Okay? So if you can imagine that your husband went out and he started digging up the dirt around your mailbox, that mailbox is going to get wobbly and fall over, right? That's what happens to teeth. So this is actually two x-rays of the exact same person. This is the exact same tooth. Here's the bone way up here. And years later with periodontal disease, the bone is way down here. The bone's going away on this person. This is what happens. Now when that bone goes away, teeth get loose, and you're more prone to infections and toothaches and abscesses, okay? So this is a very, very interesting fact. Most plaque in the carotid artery, the biggest artery in our neck, contains the same exact bacteria that's found in periodontal disease. Okay? They know this by sampling these plaques. Alright, so we're seeing this connection, this inflammation and this bacteria in our mouth. It's not just in our mouth. It makes it all the way around our body. Okay, y'all follow me? So the American Heart Association did a very, very interesting study. And what they did is they took 101 patients that were currently experiencing heart attacks. Okay? And what they did is they took that blockage out of that vessel and they tested those blockages. And what they found is that 75% of those blockages had the same bacteria that causes cavities. Okay? 35% of those blockages had the same bacteria in them that causes gum disease. All right? So we're seeing a really, really strong correlation now from your oral health to your total body health. Okay? 50% of this, 50 out of 101 of these patients all had a cavity. When they went to see their dentist after their heart attack or stroke, half of them had a cavity in their mouth. Okay? So what the American Heart Association said from this study, that they say that 50% of heart attacks can be triggered by an infection in the mouth. So because of studies like this, the American Association of Cardiology, you know cardiologist, that's a heart doctor, the Heart Doctors Association, and the Gum Doctors Association. The gum doctor is a periodontist. The American Association of Periodontology and the American Association of Cardiology, they put this statement out after going through several of these studies. What they said is physicians and dentists should warn all of their patients with moderate and severe periodontitis of their potential for cardiovascular disease. They felt like every single patient that has this needs to be warned about the role this can play in your heart and in your brain. Okay? They went further with the statement and they said patients with periodontal disease should have an annual complete physical, including blood pressure, cholesterol, diabetic testing like we talked about with that OGTT, and the family history of cardiovascular disease should be established with anybody that suffers from gum disease. Okay? So how do we prevent oral infections? I recommend that you go see your dentist at least twice a year. You need to make sure he's taking x-rays at least once during that year. At least one of your 2 visits you should have x-rays. And they should be doing what's called a full mouth probing. Now what a full mouth probing is when we go in here with little instruments and we check on your gums. We got a little measuring tape and we check and see how much of this gum, how big this hole is here, okay? So you need to have that done at least once a year. It's not painful, it's really easy to do. And every 5 years you should have what we call a full mouth set of x-rays. See, when the dentist takes an x-ray on you once a year, it only shows the tops of the teeth. It only shows this part, okay? It doesn't show anything that's going on below ground. So you could have a big abscess down here or periodontal disease or other problems going on down underground, under your gums, that those routine once-a-year x-rays never see. Does that make sense? So you need to make sure he's doing what's called a full mouth series of x-rays. And you should go next time you see him and ask him when the last time he did one of those on you is. Ma'am?